You are still watching this morning on ITV. It's time now to look at our first discussion point where we be making analysis of the second phase of COVID-19 vaccine. And we've seen so many issues that have come up as a result of the second phase, where the federal government, through its agency, the National Primary Health Development Agency, is battling on how to ensure that selling of COVID-19 vaccination card is checked, and of course also working out on how to have some kind of security on the card so that it will be difficult to falsify. But even as at that, if you have this card and you are scanned, it definitely will show whether you have been vaccinated or not, whether you've taken the first dose and waiting for the second dose or not. So there's really no need for you to have these cards if you have not taken vaccination cards. We also have, of course, the one that is making the round, which is the call, by the Presidential Steering Committee on Control of COVID-19 on civil servants to make themselves available to take the vaccine. But these have been misinterpreted in some quarters to mean that the federal government has made it mandatory for civil servants to take this vaccine. So we'll look at this through the eyes of a public health expert, Ume Chukunonso. Very good morning.
Good morning.
You're welcome.
Good morning, Joe. It's nice to see you again.
Second phase started on the 6th of August. And we are still on 8th. More vaccines are coming. The last one is from France, about 501,000 doses of AstraZeneca, and we're still going to be expecting more.
And we're expecting even from Pfizer as well.
Yeah. So let's hear your opinion on all this.
All right, interesting. I must say, apart from non-pharmaceutical interventions for managing COVID-19 or protecting against COVID-19, vaccine is one strategic way we believe that is going to help to keep us safe from the disease itself. But the challenge is around making it mandatory or forcing people again to have lots of connotations around it. So first, I think, let me start from explaining the two. When I saw that statement, it came from the two angles. So when I read it, so it's saying you must be vaccinated or you present a PCR result of your COVID-19 test, right? So where also my concern on the second part is, if you present a PCR test, does that mean that every few weeks you still present a PCR test result, knowing that the PCR test result costs not less than, the least you can get is 35,000, which is above an average civil servant salary. There are some civil servants that don't earn more than 35, right? So you see that angle to it. So they still have to even explain more if you choose the second part, which is if you don't vaccinate yourself, you provide a result showing negative that actually you've been tested. So does it mean that that's one testing protects you, that after testing negative you are not going to get the disease again, right? So it means that they should also put that after so and so period you go for that test again, which is not feasible. You know how hard things are. The economy is biting hard on lots of people. The inflation rate is crazy and rest of them. So this actually has three implications. One of them is the legal angle, the second one is the medical angle, and the third one, you have the economic angle, right? So now, let me start from the legal angle. All civil servants, for now, don't have a law actually making it a compulsory that everybody, so if you make it a law signed by the president, so it means that in as much as when you are giving your employment letter, contract letter, as a civil servant, you weren't captured that you must be vaccinated, but that law supersedes that component. But so far there is no law so far. Your initial contract when you're joining civil service never made it compulsory that for you to come to your office or your report to your duty station that you must present a vaccination evidence. One. So it means that you're infringing on people's rights in terms of freedom of choice to do what they want to do with their life. In as much as in international public health law, there's a component that says if you have a disease and intentionally want to infect others, is a case of misdemeanor. So that's how they define it in international public health law. So it means that you are liable to a jail term, likely possibility of even a life jail term. Do you understand? So that's massive. But whereby you actually don't even know that you have such and you transmit it, is pardonable. Do you understand? Which can happen to anybody, because sometimes if we don't screen ourselves to know our health status, we might not even know that we have some of those things, right? So there are lots of legal angle to it that makes it quite questionable if we read it from the angle that you must present this vaccination card for you to be given an access to your office. Now, if you look at the medical component, so if you make it compulsory for everybody to vaccinate, there are lots of issues or complications that comes with anaphylaxis reactions. So, for example, you call it AEFI, adverse effects following either injection or drugs or vaccination or AED, as the case may be. So some people react differently to different components of a vaccine. It might not be the active ingredients, do you understand? But some of the preservatives that could actually make those vaccines to last longer. So different people react differently to it. So we've not been able to have a robust base and database on AEFIs, on reactions people that have actually experienced after taking those vaccines. If you ask lots of people that have taken those vaccines, they give you, I've been vaccinated and I know the reactions and rest of them, which I wasn't scared when it happened, because I have this medical background, knowing that there's bound to be reactions within the body that makes you feel weak, localized pain at the area of injections. Sometimes makes you feel as if you're feeling sleepy, weak, and rest of them. Those little signs as if you're having malaria, but within a day or two it clears off and you are very okay. Do you understand? So lots of people might not have reported such. We don't have a robust database that actually have...
No, I think the last briefing talked about the fact that the NPHCDA carried out a survey on those that have taken the vaccine to actually ascertain the rate of adverse effect of the drugs, and discovered that a very, very good percentage of those that have taken it say they didn't really have adverse effect. I think it's only one that has severe adverse effect and was treated. But the bottom line remains that no case has been reported of somebody dying as a result of taking COVID-19 vaccines.
Good. So now the question is, what's the sample size that they were able to take for them to ascertain that there is none, right? So if out of over 200 million Nigerians, maybe for example, only 500,000 have taken the vaccine, and you sampled 1,000, is that representative enough?
You can infer with that one, because in a population you really cannot sample everybody.
For sure. That's why I say is it representative? That's why I say is it representative
enough? Is concerned, but you can. In every group, as the case may be, every state, so to speak, or you localize it to the council area, you can pick randomly, actually, and you also categorize it into ages, and then I think that's what they did.
All right, so I'm still waiting for them to publish in details the criteria and the steps they took. Actually, that's going to even help in the long go of buying people's confidence back.
Yeah, but that at the peak of COVID-19 in 2020, between April and May, we had so many, restrictions of movement, and that the Constitution expressly sees that as a violation of right. But when it has to do with health, infection, transmission, those rights sometimes are kept in the law. I'm sure this is what the presidential side committee is attempting to do. It has to do with life. We need to have herd immunity. People need to speak up. And these vaccines are coming. They are very expensive. For now, we are getting them for free. Remember when the COVID-19 test started, it was for free. And people were reluctant. Today, you pay as much as 40, 50,000, depending on the facility you go to.
Exactly.
So, in order for us not to waste what we are getting for free now, the international community is watching. A time will come, they'll stop giving you, and when that time comes, traveling will be a little bit difficult for you, especially when you're going outside the country.
All right.
And you now have to come back to the government and say, I will need this vaccination. And at that time, it will be expensive.
No,
so why don't you take advantage of these free doses of vaccines that are coming now?
So you can see you're doing what government's supposed to do in a wrong way. So you're now advocating why can't
no, somehow I just know that this is what I'm supposed to do.
So that's the stuff. So in as much as those vaccines are produced even in the Western world, they've never made it compulsory. You understand? So you don't even supposed to cry more than the bereaved. That's one. Secondly, like I was saying in the medical angle, there are lots of people that actually. When was the last time you went for screening? Apart from if you have symptoms, you go to hospital. Do you on a good day go to I'm feeling very fine, but I just want to go for screening? Be sincere to yourself. And I know you are an average person, so you are not, I won't categorize you at the lower this, and you are not at the top, right? So you are in middle class. So when was the last time you went for screening?
You should be talking while I'll be asking the questions. You can't take my job.
I know. So I'm just trying to clarify, like, put ourselves in perspective. So what I'm driving at is people hardly even go for the screening to know some of the things, those things they are react to. People have allergic reactions to different things. Some people don't eat shells, some people don't eat this, some people don't eat that. And likewise, some people don't react to certain components of some drugs, which is why in some hospitals, in most hospitals, by guideline, they're supposed to ask you certain questions before they give you certain drugs. Like my own mom, you don't sedate her, she will die from there. Even if she's going through an operation or a surgery. So if you sedate her for her to sleep, she will know she won't wake up. So it means that anytime there's something that's supposed to happen in a theater, they ask her questions and she said that. So they will keep her awake. They will give her local anesthesia that will numb the particular area that they're going to work on. Do you understand? So if people don't have money to go for those screens to know what they're exposed to or what they're reacting to, they are bound to be risk of those severe ones. The minor ones that happen, and all of us are very okay, meaning that it's very normal for it to happen. Do you understand? But do people have the funds to handle that component when it becomes severe in some people that have not even had such experience before? Do you understand? So likewise, polio and rest of them, there are time, those vaccine preventable diseases, there are time they are very rampant and the mortality rate was topping and hitting the sky. It was never made compulsory up to today. What has government done best? And they did superbly well. Continuous advocacy, putting out the message out there, engaging the communities. Traditional rulers know very much, even if they don't know anything, all of them know about polio. Go to most rural places and ask even a traditional that doesn't hear English. They know something about immunization. So government went extra mile, engage people, go house to house, yet there are rejections in some houses up to today. But nobody has been jailed because of that. Yet they persisted in pushing it, and now the coverage rate and herd immunity has gone up very well. That even polio cases, when was the last time you heard of polio cases in Nigeria? Do you understand? So if we can adopt such procedure, yellow fever at some point was that way. So we were begging people to come for yellow fever until you get to the point whereby they have to put a mechanism and say, okay, you can come for it, but whenever you're traveling abroad, because it's been under the public disease of importance. Do you understand? So you must be vaccinated. Now you get to the point, if you're traveling now, you have to go and vaccinate and get your yellow card. So there are different mechanisms to make people do it without actually enforcing it down their throat. So there are medical connotations around it. So when you talk on the economic component, you've mentioned some of it, meaning that even the text, as the case may be, is very expensive for you to keep testing and retesting yourself. And we believe that if, as a matter of fact, I'm an advocate of vaccines, do you understand? But I wouldn't want a situation whereby you choke people or you force it down their throat. But you win their trust. If you lead by example, win people's trust, you spend less in making people to even do what they're supposed to do. That's the bitter truth. But when you're not leading by example and you are telling people to do something
but if you take
differently,
if you take a look at what the number that we have vaccinated as at last week is, a figure a little higher than 2 million. That's for complete vaccination or for complete
for second dose,
second dose,
yeah.
And that is about
1%.
Now,
1%.
is that encouraging?
Not at all.
So what's happening?
Not at all. So it all revolves around what I mentioned. When was the last time? Even these efforts on polio have gone to the lower level. Initially, it's always in the screen. You see Rotary coming in from the private sector. You see different organizations coming in from private sector to even support what government is doing by saying vaccinate during campaigns. They go with cars, with public address system and rest of them, and make noise about those vaccination. And with time, subconsciously, people say, what's this? Oh, there's no big thing about this thing. Let me just go and do it. There's some part of this country that even if it takes a mother to go in some southern part of Nigeria, they can spend money to pay for vaccine even if you say you don't have in your hospital. There are still some parts that you actually have to give them some stipend or woo them into taking it. Do you understand? But those things are efforts. I believe in those parts, there are also going to be time whereby most of them will feel very free and will be looking for even where to get their child vaccinated. It's all about engagement and advocacy, pushing those information out. Have we actually, for this COVID-19 issue, actually engaged the community levels adequately the way we should? Do they actually know what they're supposed to do at every given time? Do you understand? Those are the things. So if you make it local, just like people normally say politics is local, this one medical interventions in this public health component is local, it's localized. When you bring it down, even the preventive mechanism will go a long way in even giving us a degree of herd immunity that we are expecting to see. Do you understand? So, but you don't just focus on one particular direction, you focus on multifactorial. So, non-pharmaceutical component, the vaccine, do you understand? Then put in the treatment if someone comes down with such disease and rest of them. So, you see that everybody working, we are heading to one direction, making sure that we keep the country safe without actually infringing on anybody's rights.
Okay, but so far, what is your assessment of the exercise? Especially those at the rural communities where you see the team of vaccination and nobody is on the queue.
All right. So I think I mentioned one time in this in one of these show that government should look at adopting what's it called, the mechanism they use for routine immunization in Nigeria, whereby they do campaigns, they go to even house to house as the case may be. Some people actually are sitting on the fence. Let me be sincere with you. They're sitting on the fence. Not that they're so scared to go and take it, and not that they're so confident to go and take it. If you bring it to their doorstep, you've gone a long way in pushing them from the top of the fence to the part of saying, since it's here, what is there? I won't stress myself going to. I had a friend who have called me from Owerri. He said he had gone to about 3 different facilities and each of them said that the vaccine is finished. And was asking me, please, how can I recommend, who can I talk to that could get a facility that he can go and get the vaccine? In as much as there are particular places that you have that focus on, that the vaccines are really available, even begging for people to come, and medical personnel are just there sitting. There are some places that also are looking for those vaccines. Do you understand? So, supervision, monitoring those areas, seeing there's need, if possible, when a place where they have a surge of people coming in to take those vaccines and there are apathy there, you can pull in from these places that they have this in and supply there. Automatically, those numbers we are expecting to increase will be increasing. Do you understand? So, whereby people are not coming to a hospital to get those vaccines, we can adopt the campaign mechanism. Go house to house, go street to street, and rest of them. Now, they've moved to the phase of going to religious institutions. I know in my church they came, and because of the fact that they came to my church, I was surprised to see the number of people that took the vaccine. Meanwhile, we've been shouting, go and take your vaccine. But for the fact that it came to church, after the service, as people are leaving the gate, they are just picking the vaccine, taking their own vaccine and going. I say, wow. So there are lots of people that are, like I mentioned, sitting on the fence. If you bring it close to them, they'll just budge and say, let me just take this vaccine. So you mustn't even force people. As a matter of fact, if they transit from the religious bodies, mosques, churches and rest of them, and even going as far as going house to house for campaigns, making it even if it's every once in a quarter or once in a month. I don't know how much fund we have to do it monthly though. So, but if we adopt that campaign mechanism, we are going to go far. You've seen some of those even civil servants taking it in their home. Without even being forced, they will voluntarily take it in their home because it's in their doorstep. So a different mechanism of killing a rat without seeing the blood. So that's the thing. So either you kill it by hand, match it, use that poison and gum or anything. So we can still achieve the same purpose with different mechanism without actually causing the rift of somebody suing, because before you know what's happening now, you start seeing that they sue the government for infringing of right and rest of them, and strike will falling. You see civil servants agitating.
Yeah, well, but nothing was said concerning whether they will be surcharge or they will be sacked, or you just look, just go and take it so that you now give some kind of impression to other people also to want to go and take it. There are opinion molders. The people are just watching to see what Mr. Chukwunonso will do.
Yeah, exactly.
If he takes it, then that means it is good. I will take it.
But it's true. There are lots of people
so long as
Chukwunonso
refuse to take it. Yeah. When I traveled to my village, I made over 50 people take the vaccine.
Exactly.
I saw the
team leading by example.
I saw the team in the market square. They were just there, so alone. And I asked them, what's happening? They said, they have been here, and the people refused to come. And I saw people around them. And I told like 3 people, have you taken it? He said, no, take it. I said, take it for what? No,
And in their presence, you took it?
No, I told them I have taken it.
Okay, you've taken it already. Okay.
Say, I have taken it. I also told them, this thing you are seeing for free here now. If you go to the city, the queue is so long.
It's so long.
So why don't you just take this thing? And reluctantly, one person took it and said, because I said it.
Yes. They trust you.
Yes, of
course.
Trust?
Is that trust?
Yeah.
Winning people over.
And then before you say Jack, the queue now was very long because Joseph Kadi said it is good.
Exactly.
Right?
And not just because you said, they trusted you.
Sure.
Do you think any other person, is there anybody that will just come there and say, is this, and they will listen to the person?
So, they were actually scared that if they take
it is not from there.
I said, look,
I
said, nothing will happen to you.
Exactly.
We took it, nothing happened to us.
They trusted you.
So, now that we are, definitely we'll get to that point where people will want to take it.
Exactly.
Because I'm sure those that took it will pass the message across, and they'll even go to the, those hamlets, settlement, and then bring them to come and take it. But a time will definitely come whereby, like the situation in Imo, where the guy went to 3 different
looking for vaccine
sites, and there was no vaccine. That time will come. Nigerians will want to take it, and there will be no vaccine.
Exactly.
So what can we do to prevent such occurrence? Because we are still relying on donations.
Exactly.
Because those that have donated, you don't expect them to give you again. France brought 500,000, the US government, the UK government, you don't expect them to bring again.
Exactly. So one big challenge about vaccine equity is the need for even poor countries actually to have access to vaccine, right? But we can't keep relying on donations forever. So I can beat my chest and tell you that Nigeria actually could handle that. The only challenge that we have within the country is misplacement of priority. So in a situation whereby you are budgeting how many billions to track WhatsApp, and meanwhile health, which is one of the most important things, that actually, as a matter of fact, even security builds on health. A military man that is sick can't even carry a gun. That's the truth. A governor that's sick can't even rule the state. A president that is sick can't even do anything. Sometimes we relegate health on the background and only come to the forefront when we are hit hard. If we prioritize health, provide adequate funding, if we rechannel most of those funds that are put in irrelevant things. When I say relevant things, things that we could look at later when we have Essex funds, as the case may be. You understand? And look at health. You can imagine pushing the whole funds that they are budgeting to track WhatsApp and do other things, and push it into health, and say we are using it to procure vaccines, as the case may be. We can go a long way. Nigeria has been procuring vaccines for the routine immunization, in as much as Gavi is supporting. So, but Nigeria is providing a counterpart fund, in the sense that the federal government is providing some part of the money, and the donor agencies are providing some part of the funds for UNICEF to help them procure. Do you understand? So, we can also do such if we can procure vaccines that caters for all the under 5 in Nigeria, children under 5 years of age in Nigeria. We can go extra mile, just put in extra effort, and we're going to achieve a lot. Seriously. So you see a situation whereby the country goes as far as going to borrow money and use those monies to buy cars for maybe senators, House of Assembly people, and rest of them. Misplaced priority. As a matter of fact, most of those guys, all of them, not most of them, all of them, that none of them that came to that house without at least 2 cars. All the senators, their own. I didn't mean government giving them. They have cars, exotic cars. So why prioritize and giving them Prados, Jeeps? Most of them costing more than 50 million, and if you multiply the number of senators and House of Assembly members that we have, check the money. You see that some of those money actually could go into, rather give them that money, give them some part of the money to be maintaining their own cars, than, because each time the new set of legislators comes in, so they come with a bag of responsibility in terms of buying their cars and rest of them. So if we just, I see it as just misplacement of priority. So if we can rechannel some of the funds that's being wasted on some things that are not relevant, so we can achieve this. We can buy vaccines. We shouldn't keep crying that we don't have money and expect ourselves.
Can't we produce vaccines?
We can.
So what's happening?
We can. It's political will. It's political will. If we can, as a matter of fact, if within the country harness our resources and put conducive environment in terms of making policies that will make these vaccine production firms to come within the country, they are going to generate even jobs. People are going to be employed, because those bottles that will be used to produce vaccine, people in the country will start producing them. Do you understand? So you can, because you don't expect them to start importing it all the way from the outside the country. So it will create job.
Yeah, but what about
and there are discussions on it, but the discussion at some point stalled. And you see people, even private sector coming out. I know about, is it General Litigious also, and about how many private sector guys that came in and said, if government is willing, do you understand? They are willing to partner with government to even pull in their own funds, because they see an investment opportunity that they will make money from and still support the government. The discussion stalled at some point, and most of them pulled out. I know when they were discussing around that 2014, 15, 16, and as of today, the whole thing died down. So what has government done to revive that discussion for us to start producing vaccine, local vaccine production within the country? They fight it. Have we? It's not that it has not been discussed. It has been discussed, but just that it has died down. We need to flame it up once more again. We need to discuss and look in that direction. And if we do that, that will be perfect.
So, you know, the president talk about pharmaceutical independence, which also has to do with some ministry, relevant ministry, liaising with international organization to pull fund and have, you know, factories for production of different kinds of drug, including the vaccine. You know, top of the town, anywhere is the COVID. So, in your own opinion, how do you think that position of the president will come to fruition?
All right. So that has been one of my biggest dreams. And I think even recently, when I got the news of one of the organizations, I think EMSO, so one pharmaceutical organization, who has started partnering with an Indian firm to be producing an active pharmaceutical ingredient. That means most of those local pharmaceutical organizations within the country don't need to import the raw materials, because what they do, almost in 99% because they import the raw materials and manufacture within the country. Now, we are going to, even the raw materials are going to be within the country, that even other ones that couldn't have such access could buy from them. So if actually within the country we start manufacturing active pharmaceutical ingredients within the country, that's a step towards achieving what you just mentioned. If the government or the president could put a foot into that statement and make it come to fruition, that will be one of his biggest achievements before he steps down. People will remember him for such. Health is one key thing. People still remember Dora Akunyele, not as a minister of orientation, or as the case may be, but what, as a minister, as the DG of NAFDAC, and what she did, she saved lots of life. Do you understand? With her actions and regulations, enforcement during those times. Do you understand? So, if people can remember the DG just for that she has done, if the president can do what he just mentioned, put a foot into his word and see it take a walk, he will be remembered forever by people, because drugs, medicines are very expensive within the country, and they're expensive because of duty, custom duty. Most of them import, and rest of them, even those that manufacture within the country, still import the raw materials. Do you understand? So the taxation and everything is crazy. So if he does that, automatically the price of medicines will drop. People can walk into the hospital and get drugs at the cheapest rates you could possibly get. And that will actually even increase the productivity among humans. So if actually I could get a drug I normally get at 2,000 naira to 1,000 naira, I will save extra.
To what extent would that create job? To what extent?
Would that create job? For sure. Within the country, automatically, civil engineers are going to get jobs in building those factories. Yes, you have construction companies coming to do those things. Cleaners are not going to be imported from China or India or America. We have Nigerians, we have pharmaceutical experts, pharmacists within the country that are very good, that will be employed. So even logistics firms that will be responsible in moving some of those drugs that they produced from one point to the other will be employed. So it has a ripple effect, do you understand? And if people have more funds to treat themselves, they spend less time at home and spend more time at their workplace, which means you generate more funds for yourself, and our GDP will go high. So the poverty index, at least, will come up at some point. So it has a ripple effect across board.
I must thank you for your time on the program.
It's my pleasure.
Viewers, that's much we can take with a public health expert, Ume Chukuno. So each time he appears on the program, he always, gets punchy with his comment, and I'm sure that the relevant agency is supposed to take note of all that he has said, and of course work with it. You can even invite him. I'm sure that he will be available. Okay, thank you so much, Ume Chukuno. So take a quick break now. When we come back, the program will continue.